My name is Chantal Spencer Grant, and I am an assistant professor of pediatrics in the Division of Pediatric Pulmonology. I'm also the medical director and the program director for the Pediatric Pulmonology Fellowship. So I'm proud to say that we have a variety of programs that we offer and that we participate in. Within our division, we have the severe asthma program, where we treat kids with severe asthma symptoms that have been difficult to control, and we offer advanced therapies. We also have our pulmonary hypertension program that is offered to patients that are high risk for pulmonary hypertension, and we collaborate very closely with the cardiology department for that program. We also have the chronic lung disease program, which is a program for patients that have mostly premature lung disease, and that's also offered inpatient as well as outpatient. And lastly, we have the pediatric sleep medicine program. So those are all programs that the pulmonary division offers. In addition to those programs, our physicians participate in many other programs are within the Kravis community. So for example, we are involved in the multidisciplinary cerebral palsy clinic, which is a multidisciplinary clinic that offers services to complex patients with a lot of medical needs. And we offer our services more like a one-stop shop visit for our patients so that they don't have to go to multiple appointments. We also participate in the recently launched Aerodigestive Clinic, which is a clinic that focuses on patients with GI, severe airway diseases. And so we offer another one-stop shop for those patients, as well as multiple ways we try to find ways to minimize anesthesia and do multiple procedures all in one day. So this program is an excellent program. It's run by the Complex Care / Visiting Doctors program. Dr. Elaine Lin has been spearheading this amazing program for our patients that are very complex. And what we offer is a place where patients can see multiple subspecialties in one visit. And so they are able to see a pulmonologist such as myself. They're able to see a nutritionist or a dietitian. They're able to see an orthopedic surgeon, neurology, dentistry, and even sometimes an OBGYN. And so this has been a really groundbreaking program for our patient population, because patients with complex needs have a lot of doctors and often require multiple appointments. This program nicely provides them with one visit where they can see all their subspecialists and then end the visit with their general pediatrician that summarizes the whole visits. And of course, the pediatrician is going to be the person that follows them long-term and in between the multidisciplinary clinic visits. So it's an excellent program. We've gotten a lot of great feedback from parents that really appreciate the collaboration between the subspecialists and how nice it is to have everyone on the same page on the same day, and also just minimizing how often they have to come to visits and navigate the healthcare system to make visits. So it's been well received, and we think it's been a valuable program for our patient population. And so we work really closely together within the clinic and even outside the clinic. Prior to the visits, we all review the patients that are going to be seen that day. And even after the day is over, we debrief and talk about all the patients and decide what the plan will be moving forward and what things need to be followed up after the visit. And if there's any surgeries or procedures that need to be done, we make sure that all of the team members give their input and decide if there's any pre-surgical or pre-procedural things that need to be done. And so we work really closely as a team for each patient. And it's actually, for the physicians, much easier than prior to this clinic trying to communicate and talk about these complex patients, over the phone or by email. So it's been a great way to collaborate with other physicians from other subspecialties, as well as the general pediatrician, to always have them in the loop. And that's been valuable because the general pediatrician always has like the big picture in mind, which has been helpful. So within pediatric pulmonology, we treat a wide range of diseases. I would say our most common disease that we treat here is asthma. We treat general asthma, but we also treat very severe asthma. We have a pretty big patient population that has chronic lung disease of prematurity, also known as BPD. We see a good amount of patients that are technology dependent, which means they have a tracheostomy or may need a ventilator. We also see patients with pulmonary hypertension, sleep apnea. We have a small cystic fibrosis program that the pulmonary group is involved in, and that's run by Dr. Maria Bordella. And then we also see a few patients that have interstitial lung disease, which is, although very rare, is a unique disease that requires a experienced specialist to treat. And one of the programs that I'm very passionate about that I run is the interventional flexible bronchoscopy program. It's one of the few programs within the Northeast region that is offered for children. And so the interventional flexible bronchoscopy program offers minimally invasive techniques to do lung biopsies and to treat other common airway diseases. I think one of the main attractive parts of our program is that we work very well together. We collaborate not only with each other as a group, but we have a really good working relationship with general pediatricians in the area, as well as subspecialists within our hospital. And so you can feel confident that when you refer a patient to us, all of us have the expertise, the knowledge, and experience to treat general pulmonary diseases, but we also have access to these really unique programs that can fit the needs of most patients that are either very general and don't need a lot of treatment or therapy, but we also treat the very complex and the patients that require a lot of care and frequent visits, or may even be eligible to participate in one of the programs for medically complex patients. And so we have access to all these amazing programs for all sorts of patients in the New York City area. So in my clinic, I see a variety of general and complex pulmonary diseases. I treat patients with severe asthma, patients that have chronic lung disease of prematurity. I also treat patients that have tracheostomies, also known as technology-dependent patients, so patients with tracheostomies that are on a ventilator. I also treat patients with rare interstitial lung diseases, patients with obstructive sleep apnea, and occasionally I also treat, and I'm very experienced with treating patients with cystic fibrosis. So that's the range of patients that I see in my clinic. But I also have an expertise and a lot of experience with patients that have airway diseases such as tracheomalacia, bronchomalacia, or different diseases that affect the airways or cause narrowing of the airways, which brings me to one of the things that I'm really proud of that we have at Mount Sinai, which is our interventional flexible bronchoscopy program. And so it's one of the few places that has an interventional program for children. Interventional bronchoscopy is something that's done pretty often in adults, and we have been able to use similar techniques for smaller kids and in children. And it allows us to just provide minimally invasive ways to diagnose and treat certain airway diseases. We're able to do lung biopsies in certain patients that would qualify without doing surgery. We're also able to do minimally invasive procedures to help alleviate certain airway problems that otherwise would require surgery. And so what's also nice about this program is that we collaborate with other physicians and surgeons and patients that have more complex needs. And so we often have our ENT colleagues or our general surgery colleagues, or even sometimes our GI colleagues come in if the patient requires other procedures, so that we can all try to have the patient seen in one day and receive all the services or procedures they need, all while minimizing anesthesia exposure. So I'm really proud of the interventional program we have here. We have a lot of new equipment that isn't available at other institutions. And fortunately, we all have the expertise to use it here. And so that's one of the very unique programs that I think we offer at Sinai that makes Kravis a special place for children.